in chapter 40. Assistant in cardiology. Like always, I'd like for you to read over your learning objectives as well as your vocabulary words. I want this chapter for you to understand. In order for you to assist in cardiology, you need to understand what cardiology is and what it consists of. So in the past, cardiac disease was frequently seen in men, but seldom in women. That changed over time. So today, most common cause of illness and death, regardless of gender, is cardiovascular disease. So if you sit there and you ask yourself, what is cardiology? Cardiology is the study of the heart. Learning the anatomy and physiology of the heart is hollow, muscular organ, and it's in the thoracic cavity. It weighs about 9 ounces and is about the size of your fist. So approximately 2/3 of is located on the left sternum. The heart is a pump that provides the force need to push blood throughout the arteries in the body. So the blood circulates in continuous supply of oxygen and nutrients to the cells and picks up the metabolic waste products from them. So I want you to continuously read throughout anatomy and physiology of the heart. However, we're going to move over to the layers of the heart. So what is cardiovascular disease? By the time we get to the end of this chapter, which is very short, you will understand what does it consist of. Okay? So the heart is enclosed in a double membrane sac called pericardium. The outer layer of the pericardial sac is the parietal pericardium. So it's a tough membrane that connects to the heart, to the diaphragm, and serves as a physical barrier to protect the heart against infections or inflammation from the lungs or pleural space. So the inner layer, the inner layer is the visceral pericardium, like epicardium. Forms the first layer of the heart. Between the two membranes, there's a small space, the pericardial cavity, which contains 30 milliliters of pericardial fluid. This fluid lubricates the inner surfaces of the pericardial membrane. So then you have the middle layer of the heart, which is called the myocardium. Keep in mind the myo. The muscular layer that continues the largest percentage of the heart is the largest part of the heart wall. So it's contracts of the heart muscle force the blood from the heart to the vessels. The inner layer of the heart is the endocardium. Keep in mind endo. Includes the heart valves that separates the chambers of the heart and provides the means of blockings that flow of blood from the major vessels entering and exiting the heart. So you have the heart, chambers, and arteries. The heart is divided into 4 chambers. Let's look into figure 40-1. Let's look into figure 40-3. So they have it broken down to the artery. The top chambers receive blood in the ventricles. The bottom chambers that pump the blood out. You have the blood flow through the heart begins to the right atrium, which receive the oxygenated blood from the inferior and superior vena cava. You have the atria contract, and the blood passes through the tricuspid valve into the right ventricle. You have the ventricles contrast, and the blood passes from the right ventricle through the pulmonary valve of the lungs via the pulmonary artery. So the only artery in the body that contains the oxygenated blood. Okay, so going back, the pulmonary valve does to the lungs via the pulmonary artery. Pulmonary artery, the only artery in the body that contains the oxygenated blood. So oxygenation occurs in the alveoli of the lungs, and now oxygenated blood returns to the left atria through the pulmonary veins, the only veins in the body that carries oxygen-rich blood. So the atria contrast. So basically it's telling you how the blood flow, the path of the chambers of the heart, which veins or arteries have oxygenated, oxygen-rich blood or deoxygenated blood. Okay, so the heart conduction. A sophisticated electrical conduction system operated by specialized cells located at various sites in the myocardium stimulates contraction. These muscles contractions move blood through the chambers of the the heart and out through the aorta to the rest of the body. Each electrical impulse is passed through the heart in a twisted spiral motion. So these rheumatic waves stimulates the cardiac cells to the beat that causes the heart to contract. Cardiac impulse originated in specializes muscle tissue called it's the SA node, and it beats 60 to 100 times per minute because it creates a basic rhythm. It is a pacemaker of the heart. So when you see SA node, think of pacemaker. Okay, so of course, like all other systems of the body and any other parts of the body, we have diseases and disorders. The diseases and disorders of the heart consist of you have coronary artery disease and myocardial infarction. Many diseases and disorders affect the heart and its blood vessels. Disorders that occur with rhythm of the heart becomes irregular are addressed in physical electrocardiogram chapter. So when we get further back into the EKG chapter, that's when we will cover the disorder. However, cardiac disease is multiple risk factors. Some of these cannot be changed, and others people can change or seek to have treatment. The more risk factors a person has, the greater his or her risk of development of the cardiovascular disease is. So we have coronary artery disease and myocardial disease. Coronary artery disease, known as CAD, causes almost 500,000 deaths in the United States every year. In CAD, the formation of atherosclerosis, plaques narrow the arteries supplying the myocardium, which results in lack of blood supply to the heart muscle and may ultimately leads to myocardial infarction. Okay, so as we get into the how to monitor the cholesterol levels, what levels are cholesterol levels, what are the good cholesterol, what is the bad cholesterol, and what is the total cholesterol, I'd like for you to read over those. And continue to read throughout, understanding what is a systematic until patient may be asymptomatic until the disease becomes fully developed. Read throughout that section right underneath triglycerides and such forth. So, in the recent years, the rate of heart disease has declined in men, but not in women. Traditional risk factors negatively affect both genders. However, women are at greater risk if they have metabolic syndrome, a combination of hypertension, elevated insulin levels, and excess body fat around the waist, high blood cholesterol levels, and such forth. If they have increased levels of stress and depression, if they smoke, female smokers are at greater risk than women who do not smoke, and if they have reduced estrogen production before menopause. So I'd like for you to read over table 40-1, prescription medication to lower blood cholesterol. Sometimes this medication you usually just hear, so in this chart they have the generic name as well as the common name. The major concern of a heart disease is lack of blood to the myocardium, which occurs when vessels become totally blocked. Look at figure 40-6. You have 5 different pictures. You have A fatty streak, and it shows you what it consists of and where is it layered. You have B, plaque. C, formation of thrombus. D, complications. And you have E, embolus. It explains to you throughout each picture what and where these developments are leading to aortic occlusions and how it affects the heart. I would like for you to read the 2 charts that's listed on page 920. Metabolic syndrome, what is it? How is it a risk factor? And signs and symptoms of MI in women. Okay, so diagnostic and therapeutic procedures. And MI is diagnosed by ECG, changes in elevated cardiac enzyme. So, say for instance you have ECG done and blood work. The blood work, the traditional blood test that indicates myocardial damage is creatinine kinase, CK levels. CK levels begin and increase within 3 to 12 hours of an onset chest pain. So the reach to peak values was in 24 hours and return to the baseline after 48 to 72 hours. The most severe cardiac damage, to the longer it takes for the CK levels to peak and then return to the normal. However, another blood test damage measures your troponin levels. Troponin is a protein that is released into the blood only when cardiac damage occurs. So if you ever go to the doctor and you have a CKMB and a troponin test that's done, the doctor's checking to see if a person has had a heart attack and what was the peaks and if troponin has been released into the bloodstream. However, CKMB have its 3 to 12 hours onset of chest pain, but the value's supposed to reach the peak levels within 24 hours and return to the baseline within 48 to 72 hours. So if you don't have treatment done or seek medical attention when you having chest pains and you thinking it's a heart attack, or some people have mild heart attacks, then you can overlook it because of the medication, the blood test, which in the 48 to 72 hour goes back to its baseline. It goes back to the bottom. So you would never get that peak. However, troponin levels will tell you if you've had a heart attack or your myocardial muscles, tissues have been damaged by the enzymes being released into your blood system. Okay, so I'd like for you to continue reading over that. Let's do a critical thinking. It's on page 922, 40-2. Critical thinking application. You will need to review that because that will be a chat for us while we are Skyping. Okay, so hypertension, heart disease. That is a chronic elevated blood pressure. When you see hyper, elevated. When you see anything that says hyper, you immediately think of elevated. Hypertension, heart disease. Chronic elevated blood pressure can result in a left ventricle hypertrophy, enlargement, angina, MI, or heart failure. Hypertension is also a major cause of stroke and neuropathy, which is kidney disease. Nephropathy, which is a kidney disease. So some risk factors of hypertension can be family history of some hypertension or stroke, high blood cholesterol, smoking, high sodium intake, diabetes, excessive alcohol intake, lifestyle, obesity, aging, prolonged stress, race, African American have higher incidence than Caucasians. Okay. Hypertension has an insidious onset. The patient shows few, if any, signs, so that's why they call it a silent killer. I would like for you to continuously read over that. The two types of hypertension are primary hypertension and secondary hypertension. Understand the levels of what are considered hypertension and what's considered secondary hypertension. So medical assistant can play a major role in the antihypertensive therapy by teaching the patient how to take his or her own blood pressure at home. Home education is a must, but you have to let them know how to monitor their blood pressures at home and what to do if they're high or too low. So let's move over to table 40-2, stages in treatment of hypertension. Blood pressures have pre-hypertension, stage 1 hypertension, and stage 2 hypertension. Read over how they're treated, what's needed. If the pressure is in pre-hypertension, what are some treatment that the doctor may give? Read over that so you can have some type of knowledge if you have to hear that or assist in this cardiology area. As well as moving down to table 40-3. I would like for you to know and understand the medication used for to treat hypertension, the classifications, the actions, and the treatment protocol. Alright, so we have congestive heart failure, CHF. It occurs when the myocardium is unable to pump an adequate amount of blood to meet the body's need. So although the onset can be acute, the condition typically develops over time because of weakness in the left ventricle as a result of the chronic hypertension. So MI of the left ventricle wall, the vascular heart disease, or pulmonary complications, typically the heart failure initially occur on one side of the heart and then on to the other side. So read over that and understand what is CHF, congestive heart failure, what causes it, how does it affect the body, and also Consider how the blood flow is needed and what does it affect in the blood flow. Authors say hypotension. Understand the diagnosis of the patient, what can be some symptoms of that patient, and how can it be treated. I want you to test yourself. When you're reading through this, is it medications that you can see that the doctor would prescribe for a patient based on the treatment that the medication treats and based on the conditions that you're reading? So kind of do a case study while you're reading through this, flipping back and forth, understanding, okay, this is what this test, this disorder or disease caused, and this is the medication that treat this. So would this be a medication that the doctor can potentially prescribe? Okay, then get into inflammatory or vascular disorders. We have rheumatic heart disease. Read under those, understand how is it treated, is it anything that can stop or prevent this from happening, and what is the certain types of rheumatic heart disease. And the valve disorder, same there. As we move into blood vessels, I would like for you to look at figure 40-7. Throughout the systematic arteries and systematic veins, you would see the name of them and where they start and where it ends. So understanding blood vessels is divided into two systems, begin and ends with the heart. So the pulmonary system carries the oxygenated blood from the right ventricle to the lungs and oxygenated blood back to the left atrium. Read that and understand where's the flow of the blood vessels. We have arteries. I want you to read that and understand what they carry. We have veins. Same there. We have vascular diseases. Under vascular disease, we have vascular system. Consistently supplies blood containing oxygen and nutrients to the body tissues and pick up waste from tissue metabolism. So under that, I want you to read under shock. On table 40-4, types and causes of shock. I want you to read under that and understand what caused it, how can it be, and what it is. Vein disorder. We have varicose veins. We have deep vein thrombus. I want you to read and understand how can those and what type of treatment is needed to help those conditions. Atrial disorders. I want you to read over those and understand how it is affected and how can they be treated. Diagnostic procedures and treatments for those. Throughout the cardiology, assisted in cardiology, there's different types of procedures that can be used to detect these different types of diseases and disorders of the body. I want you to read over those. So, heart disease and stroke account for more than 1/3 of all in the United States. 1/3 of all deaths in the United States. So genetics, you have lifestyle factors, you have smoking, that can be a factor, lack of exercise, poor diet, playing significant roles in development of heart disease. Okay, so successful management of cardiovascular disease requires major lifestyle changes for most patients. Medical assistance can help by providing encouragement and support by using community resources to help patients find assistance to these changes. Okay, there's different types of websites that you can read over or you can refer them to or get printouts from to help educate your patients once they're outside of the doctor facility. So before I close, I would like for you to look at your learning objectives, answer all of those at the best of your ability because that will be some live questions or chats. It can be a lot of information. That's why I keep getting you to read over your learning objectives and what's the main points of this chapter that can help you understand the cardiology chapter better. So we can use that when you become a medical assistant, okay? So I want you to know the types of shock, which was listed on a chart. I want you to know the characteristics of a common vascular disorder. I want you to know the outline of basically the cardiovascular diagnostic procedures as well as the educational topics, legal and ethnic issues for a cardiovascular patient. That consists of Chapter 40, Assistant in Cardiology. Until next time, bye-bye.